This presentation is about addressing the quality of health workers in the workforce through education and training. Many countries face challenges on how to address the health workforce shortage by 2030 and how to provide health services that meet population health needs to achieve universal health coverage. Common challenges include market failures in health worker education and employment, such as a mismatch between curricular content and population health needs. This can mean that health workers are ill-prepared for the transition to practice. WHO recommends competency-based education rooted in population health needs as the most effective approach to prepare health workers for practice. Competency-based education approaches start with identifying population health needs, the services that health workers will provide on course completion, and the context and teams in which they will practice. From this, we can identify program outcomes and the competencies required, and then build the curricular content, including the essential knowledge, skills, and attitudes. Competency-based education is about the application rather than the acquisition of knowledge in the context of practice on course completion, what we call practice activities. The provision of health services is not a simple checklist, and so practice activities only tell half of the story. Health workers need technical skills and competencies to decide on the best course of action and treatment for individuals or the community, to be able to communicate and collaborate effectively in teams. Each context is different, and learners, soon to be health workers, need to be able to navigate the complexities of health service provision. The holistic approach of competency-based education focuses on education programs that enable the learner to develop the competencies they need to perform the practice activities for the context, underpinned by knowledge, skills, and attitudes. Competency-based education requires a whole-of-program approach to learning and assessment. This means sequencing the learning progression to enable the learner to acquire increasingly complex knowledge and apply it in different contexts with increasing autonomy and complexity. Tailoring the learning experience is important. This involves learning in clinical practice, problem-based learning, and competency-focused instruction that enables learners to solve problems and find knowledge independently, receiving feedback, support, and supervision along the way, and develop their competencies for practice, such as interprofessional collaboration. Programmatic assessment of education outcomes is also important across a range of situations and contexts. Competency-based education is associated with better preparedness for practice. It is accepted by learners, by faculty, and by employers when the curricula is oriented directly to the services to be provided on course completion, and the outcomes are valued by the health labor market. This way of learning is also associated with a faster pace of learning, greater student satisfaction, and improved gender equity and inclusion. In 2022, WHO published its Global Competency and Outcomes Framework for UHC, which guides educators on the principles of applying competency-based education to curricular design. It highlights the 24 competencies that are essential for all clinical practitioners. This includes placing people at the center of all care, decision-making, effective communication, interprofessional collaboration, evidence-informed practice, and personal conduct. The competency framework guides educators to identify the practice activities that will be within the learner's scope of practice upon course completion, the contexts in which they will be practicing, and the competencies, knowledge, skills, and attitudes to perform them. We think of the 4 interrelated dimensions for the design delivery of competency-based education. Having identified population health needs and the program learning outcomes, The model considers multidimensional curriculum design encompassing teaching, learning, and assessment, and institutional delivery, including clinical training places and the resources and faculty needed to provide the training. When integrating specific service content into curricula, such as updated clinical guidelines or new tools or technologies, we start by assessing the services and then identifying which tasks are within the scope of practice for the individual learner, before considering these within the broader education program outcomes. The modular design to competency-based education programs enables a more responsive approach to updating programs. All the services and the tasks within the UHC Compendium, a global repository of interventions for UHC, are mapped to the practice activities of the Global Competency and Outcomes Framework for UHC. As a starting point for identifying learning outcomes for specific services, both the compendium and the framework are useful for identifying relevant course outcomes. The curricula and content for teaching, learning, and assessment can be defined from there. This example module from the framework identifies services and tasks for the provision of HIV services, rooted in the services of the UHC Compendium. The WHO Global Competency and Outcomes Framework for Universal Health Coverage identifies the competencies for all health practitioners towards the achievement of universal health coverage and guides educators through the recommended approach to competency-based education, design, and delivery. Other tools can be used to align service planning and integration of specific content into curricula, including the UHC Compendium and the example HIV module. For more information, please visit our website or write to us on workforce2030@who.int.